Hi, my name is Margaret Red. I'm a nurse practitioner student at Maryville University, and this is my head-to-toe video assessment. This is my patient, Austin. Prior to coming into the room, I went ahead and took a set of vital signs. His temperature was 98.7, his pulse was 88, his blood pressure was 120/77, and his respiratory rate was 18. He did not complain of any pain today. We also did height and weight, and he is 5'10", and he weighs 165 pounds, and the weight per height is appropriate for him. We also had him change into a gown and emptied his bladder. We also tested his vision using the Snellen chart, and his vision was 20/20. So we're going to go ahead and go into our assessment. So I'm first going to just assess his general appearance, noting that he's well nourished, well hydrated. He looks like he takes care of himself. He was dressed appropriate for the weather, and he generally is a non-toxic appearing male. We are going to go ahead and start with our assessment. So I'm going to go ahead and start with the head inspection. So I'm going to start by inspection. I'm going to just look for any lesions, abnormalities, swelling, deformities of the head and face, noting that he doesn't have any abnormal facial characteristics and his face is symmetrical at rest. We'll go ahead and have Austin do a couple movements for us. Go ahead and clench your teeth for me, and then shut your eyes really tight, wrinkle your forehead. Go ahead and puff your cheeks out and stick out your tongue. All right, so I noted that those facial movements were all symmetrical. Next, we're going to go ahead and palpate the skull. I'm noting that the skull moves freely over, or the scalp moves freely over the skull. The hairline is normal, his hair texture is normal, and there's no lesions, no masses, no abnormalities there, no swelling. We'll go ahead and move on to palpating the TMJ joint. Go ahead and open up and close. Does that cause any pain?
No.
So there's no tenderness, there's no pain with palpation, there was no cracking, no crepitus, no abnormalities in the range of motion. We'll go ahead and palpate all the facial bones, noting for tenderness, swelling, abnormalities, or pain. I'm going to palpate the maxillary sinus and the frontal sinus and the maxillary sinus. Is that causing any pain?
No.
So the sinuses are free from any pain, as well as any lesions, swelling, or abnormalities there. Lastly, we're going to test a sensation. Go ahead and close your eyes for me. And I just want to know if these feel the same bilaterally and if you can feel them in all three areas.
Yes.
All right, so sensation is intact bilaterally. Next, we'll go ahead and move on to the eyes. We're going to start by inspecting the external structures, noting that the eyebrows are symmetrical. The end extends over the outer canthus of the eye. There is no lesions, no swelling, no redness. We're going to look that the eyelashes are symmetrical and they grow away from the globe. We'll go ahead and inspect the sclera, noting that the sclera is nice and white, free of any redness, discharge. And then we will take a closer look at the conjunctiva, noting that the conjunctiva is nice and clear and free of any redness or discharge. I'm going to go ahead and I'm going to go ahead and check your pupillary response. So if you'll take a look at my nose here, and I'm going to check for direct, and then look at the other eye and consensual, and then direct and consensual. Follow my finger to your nose. So I'm noting that the pupils are pupil and reactive to light. They're 3 millimeters, and they're also reactive to accommodation. Next, we'll go ahead and do the cover-uncover test. So I want you to put your one hand over your eye, and then just find a spot to look at. And now the other eye. All right, I'm noting for any nystagmus, anything that, any extraocular movements that would not be necessary. Now we're going to go ahead and palpate. So I'm going to go ahead and palpate around the eye as well as the lacrimal apparatus. The lacrimal apparatus feels normal. There's no discharge or swelling there. Did that cause any pain? There's no pain with palpation, no edema or lesions noted there. And then lastly, we'll do our cardinal fields of gaze, testing the extraocular moment. So I want you to just follow my pin. All right, so the cardinal fields of gaze are all intact. Their extraocular movements are normal. no nystagmus was noted. So we're going to go ahead and go on to our ears. I'm going to start by inspection, noting symmetry, no deformity, no redness, no swelling. I'm going to make sure I'm noting the mastoid as well, noting no swelling or redness. Next, we'll go ahead and palpate. So I'm going to palpate these auricles and the mastoid. Does that cause any pain or tenderness?
No.
All right, so there was, again, no nodules, no skin tags, no abnormalities on palpation, and they were symmetrical. Next, we're going to go ahead and do the whisper test. So I just want you to repeat the word that I say.
Apple. Orange.
All right, and the hearing is intact bilaterally. Next, we're going to go ahead and test ear to bone conduction to air conduction using a tuning fork. You can't hear it.
Okay. Okay.
Noting that air conduction is 2 to 1 to bone conduction. Next, we're going to go ahead and get our otoscope out and take a look inside these ears. So first, I'm going to note inside the canal that it's nice and pink, free of excess wax, no redness, swelling, or foreign body. The tympanic membrane is nice and pearly gray. There is no perforations. Landmarks are easily seen. Cone of light was seen appropriately, and there's no perforation or bulging. Next, we're going to go ahead to our nose, and we're going to do inspection. We're going to inspect the nose for any deformity, any lesions, any redness, swelling, noting that the nose is in the center of his face. We'll go ahead and palpate the nose, noting any tenderness, crepitus, deformity, pain. Any pain?
No.
So those were all normal findings on his nose. Next, we'll go ahead and look at the septum and look at the internal structures of the nose. So again, go ahead and tilt your head back, noting that the septum there's no deviation, there's no perforation, turbinates are visualized, the nair is nice and pink, there's no discharge, no swelling, no foreign body. And lastly, we're going to test the patency of his nairs. So if you'll just cover, I'll just do it for you, cover this and blow and in. All right, and now all right, and his nose is patent bilaterally. So next, we're going to go ahead and move on to the mouth and throat. So I'm going to first note that his lips are nice and pink and moist. There's no swelling, no redness, no cracks, no lesions, no abnormalities there. Go ahead and open your mouth for me. All right, we're going to take a nice look inside there. We're going to note that the teeth are free of any cracks or obvious dental caries. We're going to also note that the tongue is nice and pink. Go ahead and stick it out for me from left to right. All right, the tongue movement is symmetrical. There's no lesions on the side. There's no film on the tongue. Nothing that would be concerning there. I'm going to look at the buccal mucosa as well as the hard and soft palate. And go ahead and lift your tongue up for me. All right, there is no sign of Ludwig's infection and no sign of a tonsillar abscess. Next, we're going to go ahead and move to the posterior oropharynx. So if you want to go ahead and open your mouth up real big for me. All right, and say ah. All right, so his uvula rises midline. There is no swelling, exudate. Their tonsillar pillars are there. They are intact bilaterally, and there is the tonsils sit within the pillars, and they are 2+, and there's no redness or exudate. Lastly, I'm going to test the patient's gag reflex. All right, and his gag reflex is intact. Next, we're going to go ahead and move on to our neck inspection. So first, I'm going to note that the neck is nice and smooth. There's no jugular vein distension. The pigmentation is consistent with the rest of his body. We'll go ahead and palpate the neck first, palpating the carotid pulse, noting rate, rhythm, and density. Carotids are 2+, and the rate is regular. Next, we're going to go ahead and palpate the trachea, noting that the trachea is midline. The cartilage rings are easily felt, and there's no swelling or abnormalities there. Go ahead and I'm going to palpate for your thyroid and swallow. If the thyroid goes nicely through my fingers, it's nice and smooth, there's no swelling, no enlargement, and no nodules felt on the thyroid. Next, we'll go ahead and palpate the lymph nodes, starting with occipital, preauricular, postauricular, tonsillar, submandibular, submental, inferior cervical, posterior cervical, and deep cervical, supraclavicular, infraclavicular, as well as the axillary nodes. Noting that the nodes aren't matted, they're not shoddy, they're all less than 1 centimeters and round and non-tender. Next, we'll go ahead and check Austin's range of motion. So go ahead and touch your chin to your chest, and now back, ear to your shoulder, or side to side. That's fine. We'll do side to side first. Side to side, ear to shoulder. All right, and now do that against me, and back. All right, so range of motion is both passive and active are intact. So lastly, we're going to listen to the carotid to ensure that there's no bruits. And no bruits are heard. So we are going to go ahead, I'm going to have, we'll go ahead and do the upper extremities. So I'm going to go ahead and have Austin put his hands out for me. I'm going to note the hands and the nails. The nails are nicely groomed. They're not too long. There's no clubbing. There is no cyanosis. The hands pigmentation is consistent bilaterally. I'm going to go ahead and inspect the arms, noting that Austin does have quite a bit of pigmentation variation in his arms, all which are normal findings. He's got lots of freckles and moles, but the borders are nice and round. They're all the same color throughout, and they're all a nice small size, and they're very well defined. Next, I'm going to notice that the muscles, I'm inspecting the forearms and the shoulders as well, noting that there is no his muscle tone is good and there's no obvious deformities. So we'll go ahead and palpate. I'm going to note cap refill is less than 2 seconds and his radial pulse is 2+. The rate is regular. I'm going to palpate here. Any pain?
No.
All right, and then I'm going to palpate the brachial pulse, noting rate, rhythm, and density, noting that the brachial pulse is also regular and 2+. Go ahead and I want you to shrug your shoulders for me. All right, and go ahead and do that without me. All right, so our range of motion is good and intact, and his shoulder shrug is nice and strong. So next we're going to go ahead and move on to the back. So Austin, if I'll have you just kind of turn your body that way for me. All right, I'm going to go ahead and untie this so we can take a better look at your back. I'm going to start by inspecting the back, noting thoracic configuration. Note the AP diameter is 2 to 1. I'm also going to note the skin pigmentation, that there's no retractions, there's no increased work of breathing, and there's no obvious deformities. We'll go ahead and palpate the spine. Please let me know if I'm causing any pain.
No.
All right, so there's no tenderness along the spine, there's no step-offs, and the spine is in nice alignment. I'm also going to palpate the other parts of the back. Any pain?
Mm-mm.
All right, and then we'll do some percussion on this. See if that causes any CVA tenderness. Is that any pain at all?
No.
So no CVA tenderness, which would all be normal findings. So we'll go ahead and go into our respiratory inspection, noting the respiratory rate is about 16 to 18 breaths a minute. There's no increased work of breathing, no retractions, no abnormality findings there. I'm going to go ahead and put my hands on T10 and take a big deep breath in and out. Noting thoracic expansion is normal bilaterally. My hands rise and fall very symmetrically. We're going to go ahead and go on to tactile fremitus. So if I move my hands, just say 99 every time I move.
99, 99, 99, 99.
All right, noting that there is no variations in the vibration, so there's no increase or decrease tactile fremitus, and which would be a very normal finding. We're also going to percuss this part, so we're going to do this in a very systematic fashion, noting that I want to hear resonance and not dullness. And those are all resonant soundings. I'm also going to percuss the lateral chest, again in a systematic, noting that it is resonance and not dullness, and I'd also do the same to the other part of the lateral chest. Lastly, for percussion, we're going to do diaphragmatic expansion. So again, I'm going to have, this was by percussion, so Austin, take a nice big deep breath for me and hold it, and I'm going to percuss down, noting when the sound changes, and then take a big deep breath and let it out this time. And I'm going to percuss up, noting where it goes from dullness to resonance. I'm going to measure that, which is 4 centimeters, which is a normal finding. Lastly, I'm going to auscultate. Again, I'm going to do this in a symmetrical, systematic fashion. I'm also going to listen to the lateral chest. And I'd also listen to the other lateral aspect of the chest, noting that his lung sounds are clear, there's no wheezes, no rhonchi, no stridor, and no adventitious breath sounds. We're going to go ahead and move on to the anterior chest now, so I'm going to expose Austin's chest so we can take a really good look and inspect it. We're going to notice equal hair distribution, again, no work of breathing, or increased work of breathing. His respiratory rate still remains 16. He has no retractions. There's no skin pigmentation changes. There are no heaves or pulsations noted just by inspection. So we'll go ahead and palpate. I'm going to first palpate the chest wall. Any pain?
No.
So there is no crepitus, no subacute air, no tenderness, no pain. There's no masses. It's all really nice and symmetric. We're going to go ahead and palpate the precordium. Any pain there?
No.
All right, so there, again, is no heaves or pulsations that I feel when I palpate. There's no pain, and again, no bulges or masses. Next, I'm going to palpate the apical impulse going mid-clavicular line, 5th intercostal space. All right, and that apical impulse is easily palpable and felt regularly. Next, I'm going to go ahead and do tactile fremitus as well. I'm saying 99 every time I move.
99, 99, 99, 99.
Noting that there's no increase or decrease in tactile fremitus, and it was very symmetrical all throughout, which would be a normal finding. So we'll go ahead and listen now. I'm going to first listen to lung sounds. And now heart tones, aortic, pulmonic, Erb's point, tricuspid, and mitral. Noting that his lung sounds are nice and clear, free of any adventitious breath sounds. There's no wheezing, no rhonchi, no stridor. His heart tones are easily audible. S1 and S2 are heard. There is no murmur, no clicks, rubs, or gallops. In all 5 areas that I listened to. So next we're going to go ahead and move on to our abdomen assessment. So Austin, if you wouldn't care, just so you can put that back on and go ahead and lay flat for me. Alright, so we're going to go ahead and look at our abdomen. So we're going to start by inspection, noting the hair distribution is equal, noting that it is nice and flat, it is not bulging, there are no lesions, no obvious deformities, no abnormalities that we see there. We'll go ahead and go on to auscultating at this point. So I'm going to listen to the bowel sounds in all 4 quadrants. And vowel sounds are heard in all 4 quadrants. They're normoactive and easily audible there. So next we're going to listen to the arteries. I'm going to start by listening to the aorta, the renals, the iliac, and the femoral. Noting that there are no bruits or no abnormal sounds there. Next, we'll go ahead and we're going to palpate. So I'm going to first palpate lightly. Does that cause any pain?
No.
All right. And before I go on to deep palpation, I'm going to go ahead and percuss. Just generally, is that causing any pain there?
Mm-mm.
All right, so we're going to go ahead and percuss the liver. And I'm going to measure here. So we're going to start on the right, and we're going to just palpate at the midclavicular line, at the right costal margin, and I'm going to note dullness to resonant, and measure there. Noting that that is about 9 centimeters, which is normal. A normal finding would be 6 to 12. Next, I'm going to percuss the spleen for dullness. So if you'll roll towards me. All right, and spleen dullness is heard. Next, we'll go ahead and do deep palpation. So just again, please tell me if I'm causing any pain with general deep palpation.
No.
No. All right, so now I am going to palpate for the liver at the right costal margin. So go ahead and take a big deep breath in and let it out. All right, and those liver borders are not enlarged. They're nice and smooth. Next, I'm going to palpate deeply for the spleen. Alright, noting that I can't feel the spleen, but that would not necessarily be an abnormal finding. We'll go ahead and palpate for the aorta. And no pulsations are felt with deep palpation. We will palpate for the kidneys. Take a big deep breath in and let it out. And again. Alright, noting that the kidneys don't have any enlargement or abnormalities felt on deep palpation. And lastly, go ahead and lift your, touch your chin to your. So I'm noting that the abdominal muscles are nice and tight and firm, which would be a normal finding. Alright, Austin, if you want to go ahead and sit up, we're going to go ahead and move on to the lower legs. So I'm going to go ahead and inspect the legs, noting that the hair distribution is equal. There's no redness, no swelling, no edema. I'm going to go ahead and palpate, noting the temperature is nice and warm. There's no edema there as well. I'm going to go ahead and take Austin's shoes off, and I'm going to palpate the pedal pulses, posterior tibial pulse, and the popliteal pulse, noting the rate, rhythm, and density, noting that they are all 2+ and they are regular. Next, go ahead and we can note that the range of motion is normal in his legs as well. Nice and strong, and the muscles were really nice and toned when I palpated them. Next, we're going to go ahead and move on to our neuro assessment, which most of this we've already done. Cranial nerve-wise, cranial nerve 2, we tested vision. Cranial nerve 3, cranial nerves 3, 4, and 6 we tested with our extraocular movements. Cranial nerve 5 we tested with our facial expressions. Cranial nerve 5 we did TMJ. Cranial nerve 7 we did with our facial movements. Cranial nerve 8 we did with our auditory exam. Cranial nerve 9 and 10 we tested with the rays of the uvula. Cranial nerve 11 we tested with the shoulder shrug, and cranial nerve 12 we tested with our symmetrical tongue movement. So now we just need to test the dermatones and sensation. So just tell me if you can feel this and if it's the same on both sides.
Yes. 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 Yes.
So sensation is bilaterally intact. So lastly, we're going to go ahead and test our reflexes and do our musculoskeletal assessment. So we've already noted that Austin has really good range of motion. We did test the cervical spine strength when we did our neck assessment, when he had good passive and active range of motion. Go ahead, and I just want you to push me away, pull me towards you. Okay, and now put your hands out like this, and good, and now like this. Don't let me move them. Good. Good. All right, so now I want you to dorsiflex and plantar flex. All right, and those muscles are all really good and intact. So we'll go ahead and do our reflexes. We'll start with our brachial. And now our other. And now we're going to do our patellar. And our Achilles. And our reflexes are intact bilaterally. And last, we're going to go ahead and test our lumbar spine. So Austin, if you wouldn't care to stand up and go ahead and bend over for me. All right, noting that, and go ahead and bend back for me. All right, noting how I see good range of motion in that lumbar spine and it's nice and strong. Austin doesn't have any gait abnormalities, and his range and his musculoskeletal assessment is very normal. So that kind of concludes our exam. Austin, thanks for letting me assess you. And do you have any questions for me?
Nope.
All right, thank you.